Hi, Dr. McCarthy again, and today we're going to talk about thyroid treatment success secret number 17. Today we're going to spend a few minutes talking about your adrenal glands. Many people have heard of the adrenal glands, but really aren't very familiar with exactly what they do. Lots of times people will refer to your adrenal glands as your stress glands. Your adrenal glands are small glands that sit on top of your kidneys, one on each side in your back. They do respond to stress, physical, chemical, or emotional stress. Definitely can cause the release of certain chemicals, hormones from your adrenal glands. But the one that we're going to spend a little bit of time talking about today is how your adrenal glands respond to blood sugar stress. Remember we talked about in an earlier video the roller coaster of blood sugar, how it goes too high and too low all day long. When this occurs, your brain says, I need to have stable blood sugar, so it sends a message down to your adrenal glands and says, hey guys, help me out here. Let's get the blood sugar back up where I need it to be so that I can have a steady source of a fuel, oxygen and glucose. So what happens is the adrenal glands will kick out a hormone, a chemical called cortisol. Many of you have heard of cortisol, but I'm going to explain to you the impact that it has on controlling your blood sugar. It does a wonderful job in getting your blood sugar back up where it needs to be. But this is supposed to happen in times of acute stress, not 10, 12, 14 times a day. That's a really bad situation. Most people think that insulin controls your blood sugar. That's not really true. It's actually cortisol that has a primary effect on regulating your blood sugar. So if you've got dysglycemia, the roller coaster, you've got cortisol problems. And if you continue with this, you're going to wind up with adrenal gland problems. Your body's not supposed to work that way. As well, cortisol is also toxic to a certain part of your brain called the paraventricular nucleus of your hypothalamus. This is where your memory is contained. So if you keep pumping out the cortisol, eventually you're going to wind up with burnt out adrenal glands and memory problems. But when your adrenal glands kick out the cortisol, they also produce chemicals called cytokines. Cytokines, what they do here now, they decrease the hypothalamus and the pituitary's ability to in turn make TSH. So now this causes hypothyroid symptoms. See how it ties into the thyroid problem that you have. Now, when you've gotten your thyroid checked at your traditional healthcare provider and they checked your TSH levels, they said, it's in the normal range, you're in the normal range. Did anyone stop and evaluate your adrenal glands? I'm betting they did not. If you haven't had your adrenal glands evaluated properly, you've got to go to someone who knows what they're talking about. Stress, infections, parasites, all of these things can increase your cortisol levels. One of the things that we see now is a growing epidemic of obesity in this country. Increased cortisol leads to increased distribution of fat around the midsection. Bad situation. If you've got adrenal gland problems, cortisol problems, blood sugar problems, what you need to do is avoid refined sugar, avoid alcohols, avoid caffeine, and you definitely want to stay away from aspartame and MSG. Really bad stuff. Lots to talk about with cortisol. If you have more questions, you need to call my office right now. Get your cortisol levels checked. It's a simple test. Don't suffer another minute. Thanks.